I am Bora Gumustop. I'm a gastroenterologist with Albany Gastroenterology Consultants. Endoscopy has changed over the past 50 years. Over the past decade, however, there has been significant developments. The luminal endoscopy, where we look in the stomach and the esophagus or the colon, is now what we call first space endoscopy. Starting about a decade ago, we start looking into smaller spaces such as bile duct or the pancreas, and this is what we call second space endoscopy, done with cholangioscopes or pancreatoscopes. So these are much smaller scopes. Third space endoscopy started about a decade ago, and since then it's been gradually expanding in its indications and capabilities. Now we can actually bring these conventional procedures done outside the body now into the body, into places that we were not able to get in before. Third space procedures will require knives with special infusion ports, scissors, as well as clips necessary to close the incision sites. There are a long list of conditions that these procedures treat, starting with achalasia, which will present with difficulty swallowing, submucosal tumors, which may cause various symptoms, or early cancer that is diagnosed during screening procedures. Endoscopic procedures are shorter procedures. They are less painful at its completion, and patients do recover much faster. Development of these procedures happened outside U.S. Initially. The first cases were mostly in Japan and subsequently in China. And I had to travel to Shanghai as well as Tokyo to learn these procedures. St. Peter's Hospital has been at the forefront of purchasing these equipment. And at the same time, we need specially trained nurses and technicians to assist us doing these procedures. We've been doing these procedures in Albany since 2015. Prior to that, patients had to travel to New York City. We are very proud and happy to be able to present these techniques to the patients, not only in Albany, but in upstate New York.